I'm Dan Kirkpatrick, a retired Air Force colonel and nurse. I had the opportunity to serve in the Air Force for 34 years, the first 6 years as an enlisted aeromedical evacuation technician in a reserve unit, and the next 28 years as an active duty nurse. I started in the Air Force in December 1971. I had a low draft number, and so I enlisted in the Air Force Reserves and had the opportunity to become a medic in the Air Force. And while I was at medic training school, I was approached by a nurse instructor who suggested I consider a career in the Air Force as a nurse. I had not given any thought to that in the past, but after talking with her and talking to some other nurses, I decided to go to nursing school, which I did while I was flying aeromedical evacuation missions all over the Pacific with the unit I was in Southern California. We flew to Alaska, Hawaii, Guam, and the Philippines, and all over the United States, flying patients from one place to the next. I flew in what was called a C-141 cargo plane, but many of the other nurses I worked with had the opportunity to fly in a C-9 Nightingale, which was an aircraft specifically designed for flying patients. It was named after Florence Nightingale and saw duty in the military for many, many years before it was finally retired. My career, when I came on active duty, I was sent to Wright-Patterson Air Force Base in Ohio, where I worked as a mental health nurse for 4 years. And then I was transferred to a base in San Antonio, Texas, where I also worked as a nurse in mental health. And then I had the opportunity to be stationed at a base in northern Texas, where I worked at a hospital for a year, and then for 3 years I was the supervisor of the mental health technician course for the Air Force, where we taught young airmen how to become mental health technicians, working in either an inpatient or an outpatient environment. It was a great opportunity to teach, which I found I really loved to do, and it influenced my career later in the Air Force and after the Air Force. After that assignment, I was sent to school to get a master's degree, which I did at a university in Texas. And then I was assigned back to Wright-Patterson Air Force Base in Ohio, where I again worked in the mental health unit. After that assignment, I was sent to Andrews Air Force Base outside of Washington, D.C., and I had the opportunity there to be the assistant chief nurse of their medical center. And that was really a fantastic opportunity because we had nurses and technicians assigned to Walter Reed Army Medical Center and Bethesda Naval Medical Center. While I was there, my job was to travel between the 3 hospitals, check up on the nurses and the technicians who were assigned to those 3 different facilities. It was a great opportunity. When I left there, I was sent to a base in northern Japan to become the medical operations squadron commander and the chief nurse of the hospital. The medical operations in that base was all the patient care areas: inpatient, outpatient, inpatient medical surgical unit, and an inpatient OB unit. And that's where I learned to really become a leader in the Air Force, which was something I really appreciated that the Air Force does. It allows people in different clinical backgrounds, whether you're a nurse, a physician, a psychologist, a dietitian, you can work your way up into leadership positions. And then while I was in this northern base in Japan, we did travel throughout Japan. It was a wonderful assignment, learned a lot about the culture. My next assignment after that was to go to a base in the panhandle of Florida, where I was again the medical operations squadron commander and the chief nurse. That squadron was much bigger. We had 440 personnel assigned to that squadron, and I was their commander. And again, it was an opportunity as a nurse to be in leadership positions. The physicians in that squadron, the nurses, the technicians, I was their squadron commander, and we had a fantastic team. While I was at that base in northern Florida, I was deployed to the country of Kuwait in 2003 to be the hospital commander of an Air Force field hospital outside of Kuwait City. We were about 39 miles from the Iraqi border. While we were there, we ended up, the base went from 1,300 personnel in a month and a half to 13,000 personnel. And the base commander made me the senior medical person for the base, where we also had British medical people, Australian medical, Kuwaitis, and U.S. Army, U.S. Navy, along with our U.S. Air Force. And I must say, on a side note, we got to be good friends, especially with the British hospital that was based out of there. And their hospital commander and I became friends, and he invited us and some of our senior staff to their dining hall. And I have to say, in the country of Kuwait, it was the best dining hall. Their fish and chips were absolutely the best I've ever had. And this is out in the middle of the desert in Kuwait. Another opportunity that arose while we were there is we were at lunch in the dining hall one day, and my deputy hospital commander was a flight surgeon, and during lunch he pointed out that there was a friend of his that was there with the Army, and he joined us for lunch. And it turned out that that Army physician, he and I had flown air evac missions 25 years earlier when we were both enlisted technicians flying air evac missions in the Pacific. So it was ironic that we met in the Kuwaiti desert in a dining hall at lunch and reconnecting with someone like that. So it was a great experience. While we were there, we did treat enemy combatants. We treated an elderly Iraqi man who had been shot in the chest, and we treated a 13-year-old Iraqi boy who unfortunately had been running between buildings during a firefight, and his back was peppered with shrapnel from a grenade that exploded nearby. We treated all four of them. We saved their lives, and then we put them on a helicopter and flew them out to the USS Comfort, the Navy hospital ship that was out in the Gulf. It was a fantastic experience treating all those people. I must say our two busiest providers was our social worker and our psychologist, treating staff and personnel for what we called gas mask anxiety. We knew that the enemy had used chemical weapons on their own people and on other enemies in the past, so we were very aware that we needed to be prepared to wear chemical gear and gas masks should they fire missiles at us containing gas or different chemicals. We did have 16 real-world alarms go off, meaning that the enemy in Iraq was shooting missiles into the country of Kuwait. And I shared a hooch, a small building, with the Army colonel who was in charge of the Patriot missile battery, and he and I would talk occasionally, and he did say that 3 of the missiles fired into Kuwait, they tracked as heading to our base, and his Patriot missile batteries shot down all 3 missiles. So we had 16 real-world alarms, but fortunately none of the missiles actually hit our base, but we were prepared. I have to say that our staff and crew did a fantastic job. We treated a number of casualties of the war, plus the typical injuries that you'll see on any kind of a base. But it was a great experience for all involved, and when I came home from that, I learned a lot about leadership, and I especially learned a lot about working in a hospital in a combat zone. My Air Force career continued after that assignment in North Florida. I was assigned to the Air Force Academy Hospital. I went there to be just the chief nurse, but I was asked when I got there to also be the medical operations squadron commander again. So I had another opportunity to be the chief nurse and the medical operations squadron commander. That was a great assignment, working there with different people in that environment. And then I finally finished my Air Force career back at Wright-Patterson Air Force Base. After I retired, I had the opportunity to teach for Wright State University, both for the College of Nursing, teaching mental health, and for the School of Medicine, teaching in their Calamityville project, which is a 52-acre disaster training facility where we teach physicians, nurses, first responders of all different kinds, and other people how to deal with a variety of different disasters. So I had a great Air Force career, thoroughly enjoyed it. I've been very involved at the state level and other things. I'm the past president of the Ohio Nurses Association, done a lot with the Boy Scouts, especially teaching first aid and doing medical type things. But I had a great career as a nurse. I'm proud to say that if I was given the opportunity, I would do it exactly the same way I did. I tremendously enjoyed being a nurse, both in the military and the civilian environment, and I really enjoyed teaching at Wright State. Wright State is a great opportunity. Their School of Nursing is fantastic. I had the opportunity to work with some great faculty and thoroughly enjoyed my career and my time in the Air Force. And I would encourage anybody who's thinking about a career in nursing to certainly consider it. Talk to nurses that you know, talk to nurses that work in hospitals and clinics, find out about what a career in nursing has to offer. But I have no regrets. And my final comment is, I met my wife as a nurse. She's a nurse, so that kind of was the high point. And I joke with people, the best decision I ever made was not joining the Air Force, but meeting my wife in the Air Force. And again, had a great career. Encourage anyone who's thinking about a career in nursing to strongly consider it. Thank you.